For long, young people, especially key population, had experienced prejudice, stigma, and discrimination, creating a huge gap in accessing appropriate SRHR information and services, both in the Elgon and Mbale regions. However, through the AmplifyChange Strengthening Grant, Hope Mbale has immensely influenced and advocated for an inclusive, enabling environment for young marginalized persons in accessing sexual reproductive health services. Thanks to Hope Mbale and support from AmplifyChange, more than 4,000 young people have been reached through school outreaches, community sexual reproductive health and rights dissemination activities, and online engagements. Some of the activities included menstrual hygiene management trainings, sexuality education sessions, empowerment structured activities, among so many others.
We've been empowered with information to advocate how to make reusable pads, how to disseminate information so that it can reach a wider range of other young people.
Young people have become more aware, made informed choices, and are taking charge of their bodies. This is creating an enabling environment and increasing uptake for sexual reproductive health services and good health outcomes.
I've also been able to experience a transformation, not only in their knowledge, but in the ability to make a lasting impact in the community. I've been able to make reusable sanitary towels with the young girls in my community. I've also been able to initiate awareness campaigns targeting mostly the youth and adolescents in schools and in community gatherings.
At youth-friendly corners, young people are now able to freely and confidently access services without discrimination.
Because of Hope, we got the tent, and at least we have a space which we can use to handle and discuss most of the issues concerning the youth. And further than even the staffs, we have like 5 staffs trained at the facility to handle issues of the youth. And then also at the same time, these trained staffs have increased or helped the youth get their services whenever there is need. And the impacts, majority of the impacts are positive because the health educations have increased among the youth and concerning the SRH issues.
I'm a young person getting services at Mbale General Hospital, where we have a safe space for young people. So for now, I am so happy, glad that we can get safe space. We have a safe space where I can express ourselves, where I can talk to health workers. Health workers are open to us because they've been trained about how to handle young people. They are open because we can tell them anything. They're like mothers to us.
After health workers training, supported by the project, there is a marked willingness to offer stigma-free and friendly services to young marginalized persons.
Before the project came in, we were struggling of how to serve adolescents because most of them were not feeling comfortable coming at general referral since there were no health workers that have been trained to serve them. But when the project started, AmplifyChange, the health workers were trained and were well equipped with skills to serve the adolescents. So from that, we started receiving a big number of adolescents accessing services from the General Hospital as Adolescent Center. But when we started having the project, when it started, the number increased from 100 to now we can even get more than 300 in a month.
After Hope Mbale's engagements, we have witnessed a supportive environment and a shift in attitude and perception change, resulting into increased health-seeking behavior among the young people, especially the key population.
These community interventions increased information sharing, capacity, and people understanding of creating awareness among the young people, the parents, the guardians, and elders. We had performance reviews with Hope Mbale, facilitating it on quarterly basis, and we were able to check on our performance periodically, which kept on improving gradually over time, and everyone was able to appreciate their contribution towards this. So with this information sharing across the board, we are proud that while reviewing our performance from the status when they visited us, the teenage pregnancies, the early marriages has come down, though we are unable to measure it, but from the community department, this is often mentioned. The case rate were often high by then, but for now it is reducing. We attribute this again to information and capacity that has been built among the community structures, among the members of the community, the religious leaders, opinion leaders, and as well the health workers.
Hope Mbale's interventions have had a significant impact on the health of young people. There has been a cultural shift, review of policies, and inclusion of young people's SRHR needs in the district plans and budgets.
We are in the process of developing the Sabine Women Alternative Rites of Passage, which is a key tool that we are going to use to mentor our young girls into useful in the growth, in the progressive mentorship of our young children from childhood to adulthood. We have had proposals from Hope Mbale to have youth being included and involved in the development and in the progress of the development of this rite of passage. And so far, the alternative rites of passage enrichment has captured the interests of the youth in much of its programs. We are going to have youth mentorship centers where we are going to provide youth-friendly services.
As a sector, we know that the school health policy is desired as soon as yesterday. It is where most of our guidelines have been anchored, but we also need to take note of the different processes that we need to go through as government of Uganda to have different policies approved. We have enhanced the capacity of different teachers and key champions, for example, school club champions, because it is a co-curricular that we feel is utilized during the school clubs. I would love to request that if Hope has any need in that area, then we are open to support you on one, enhancing the capacity of your program officers on the utilization of the life skills toolkit, and then be able to scale up to the other youth and adolescents that you actually work with. We also do have lots of guidelines, and I believe we discussed this the last time we met. And to me, I feel it is important that we popularize these guidelines as much as possible. Yes, government is doing its part, but as partners who have come together, I feel it is key for us to look at those particular guidelines that are supporting re-entry of learners, that are supporting issues of mental health and psychosocial support, and many other aspects. The school health, for us to have empowered teachers, empowered stakeholders, empowered parents, empowered local governments, for them to be able to support the implementation of these key guidelines.
Young people have been empowered with hands-on skills such as making reusable sanitary pads, which has enabled many girls to overcome period poverty. Furthermore, young people are now taking up advocacy spaces and creating platforms both online and offline, leading to continuous conversations on SRHR with their communities. The impact doesn't start in the field. It begins within the walls of the organization, in the hearts and skills of the team. Through capacity building efforts, Hope Mbale has nurtured a vibrant and skilled workforce committed to advancing its vision and mission.
I want to thank AmplifyChange immensely for giving us the Strengthening Grant. This grant has been very pivotal in capacitating our staff through the funding of the staff retreats and welfare activities. We've been able to take our staff through several trainings. We've taken them through report writing, risk register management, risk register development, and risk management itself and mitigation. We've also been able to train our staff in safety and security management. So we have a very vibrant staff that can actually withstand the test of time in this country, regardless of how hard the implementing environment becomes. I want to also thank AmplifyChange for being able to pay our staff salaries. It has been a major boost to staff morale because every staff knows they are working and they're not going home empty-handed at the end of the month.
This is not the end of the story. Hope Mbale continues to advocate for an inclusive and enabling environment where young people are empowered and have the freedom to make informed SRHR choices and decisions without discrimination.